The states are suing the federal government over the Medicaid expansion, and that is unprecedented. I'm Phyllis Shelton, and I have a solution. It's a public-private partnership that allows the private sector to pay for long-term care first and makes Medicaid the payer of last resort. Today, Medicaid is the primary payer for America's long-term care cost, and that is just unsustainable. Currently, long-term care makes up a third of state Medicaid budgets, and that's projected to grow to half by 2030. Here's where we are. This country has 80 million baby boomers facing their long-term care years, 95% of whom have no coverage for long-term care. And this dependency on Medicaid is only going to get worse as new healthcare legislation goes into effect that will add 16 million more people to the Medicaid rolls. So here's how it works. Public-private partnership plans are available in most states today, and they encourage people to buy as much private coverage as they can afford. And if it turns out it isn't enough, the states will allow these policyholders to access Medicaid for as long as they need care and protect their assets equal to the benefits paid out. In the 4 states that have piloted this program since the early 90s, fewer than 500 people out of over 325,000 have had to rely on Medicaid to fund their long-term care. So it not only works, it's a home run. Now, the key to making this work fast enough for what we need in this country is for these plans to be offered in the workplace so that most Americans have access to long-term care insurance with limited or no underwriting and lower premiums. A 25-year-old can get a partnership long-term care plan with inflation coverage for less than a latte a day. And that's where you come in. The states don't have the resources to get this message out, but the power of the media can make this happen. You can get the word out that getting employees of all ages involved will build a huge body of private sector dollars to pay for long-term care later on. Except the beauty of insurance is the 25-year-old could pay one premium of $60, be in a motorcycle accident, and receive $100,000 in tax-free benefits that his health insurance would not have covered. Simply put, this is not just about private insurance. It's about delivering a service to the people. Some of you know, caregiving robs individual freedom to work a full-time job, to send children to college, to take a vacation. People want to maintain their lifestyles. They don't want to be a burden on their children. I believe for most people, the way to accomplish these goals is for employers to offer a long-term care partnership plan as soon as possible. To make this happen, I'm doing a 7-city tour to train insurance professionals how to help employers offer these plans easily. By having me on your show, you can help deliver the best solution for high-quality care in the most financially responsible way. Me? I'm trading my latte a day to protect my family and my country from the ravages of caregiving. So join me.